का हमारा टॉपिक होगा अबाउट द डिफरेंट एनाटॉमिकल पोजीशंस एंड द टर्म्स व्हिच आर यूज्ड इन रिलेशन टू डिफरेंट बॉडी रीजन्स। इससे पहले हम लोगों ने कवर किया था अबाउट द बेसिक इंट्रोडक्शन ऑफ एनाटॉमी एंड द सब डिविजन्स ऑफ एनाटॉमी। उसके बाद आया था अबाउट द हिस्टोरिकल और ए हिस्ट्री ऑफ एनाटॉमी एंड द नोमेनक्लेचर इन एनाटॉमी, जो कि एग्जाम पॉइंट ऑफ व्यू से इतनी इम्पोर्टेंट नहीं है, दैट्स व्हाई आई विल नॉट कवर दैट वन। वेल, बिगिनिंग विद द पोजीशंस ऑफ एनाटॉमी। सो बेसिकली हमारे पास चार positions होते हैं। First one is the anatomical position. It is when a person is standing straight with eyes looking forward, both arms by the side of the body, palms facing forward, both feet together. The position is in anatomical position. अब figure 1.7 में यहाँ पे दिखाया गया है कि this lady, she is standing straight. She is standing straight and her eyes are looking forward as you look here. और उसके बाद जो both arms are also by side of the body, or palms are facing forward and the feet are together. This position is said to be anatomical position, or an anatomical position can come in your observed OSPI, क्योंकि observed OSPI में the examiner will ask you कि आप खड़े हो जाए और stay in anatomical position. इसके बाद जो second position है of your body, that is supine position. It is when a person is lying on his or her back, arms by side, palms facing upward and feet put together. This position is said to be supine position. अब figure point 1.8 में ये दिखाया गया है कि यहाँ पर this person is lying on his back, और इसके जो palms है they are on the upper aspect, or they are on the upward aspect. His feet are together. This position is said to be supine position. अच्छा, ये जो positions है they can come in your BCQs. Then third one is your prone position. It is the person lying on his or her face, chest and abdomen. This is said to be prone position. A figure 1.9 में this person, as you can see, कि इसका face, इसका chest and abdomen, they are this person is lying on his face, chest and abdomen, और इसके feet together है, इसके palm जो है उसी तरह upward है। और इसके बाद जो fourth anatomical term है that is lithotomy position, और ये बहुत important है। इससे I think so one BCQ will come, क्योंकि हमारे पास भी प्री प्रॉफ में इसी से ही एक BCQ आई थी, एंड that was regarding this point. अच्छा, it is defined as the person lying on her back with legs upward and feet supported by straps or in straps. This position is mostly used in the delivery of baby. अच्छा, आपके पास BCQ आएगा the position which is used in during delivery of the baby. अच्छा, तो वहाँ पे होगा कि supine, anatomical, prone or lithotomy. So you will have to correct the lithotomy position. इसके बाद positions के बाद we will be continuing with the planes. Now what are plane? Basically the planes आपकी body को different parts में divide करती है. First plane is the median or mid sagittal plane. Well, in median plane, it is a plane which passes through the center of your body and divides it into two equal right and left halves. Plane parallel to median or mid sagittal is this sagittal plane. This one, which is parallel to the median or mid sagittal, this is known as sagittal plane. अच्छा, figure 1.11 में this is your median or mid sagittal plane which divides your body into equal left and right equal halves. इसके बाद जो second plane है that is your coronal plane, and in coronal plane it is a plane at right angle to median plane which divides the body into anterior and posterior halves. Figure 1.12 में इस बेबी का coronal plane बताया गया है. Figure 1.12 में coronal plane बताया गया है. You can look it over here. Okay, this plane is dividing the body into posterior and anterior house, and it is at 90 degree to your and it is at 90 degree to your median plane. अब इसके बाद जो third plane है, third plane is your transverse plane, which divides the body into equal upper and lower parts, and it is at right angle, to both sagittal or coronal planes. Figure 1.11 में you can easily see the transverse plane, which divides the body into equal upper and lower parts, while this coronal plane, it divides the body into equal anterior and posterior parts. However, median plane, it divides the body equally into right and left house. और ये तीनों planes एक दूसरे के साथ 90 डिग्री के एंगल पर है, but only one plane, this plane, sagittal plane, is parallel to the median plane. Sagittal plane is parallel to median plane, and this may also come in your BCQs. Now, terms used in relation to trunk. Ventral means front of the trunk or anterior. Dorsal means posterior or back of the trunk. Medial is a plane which is close to the median plane. Now look, I will again shift towards this figure 1.13 में it is described here कि जो ये आपका median plane है. अब इसके जो करीब होगा that will be your medial, while इससे जो दूर होगा that will be your lateral one, lateral term. अब इसके बाद है lateral is the plane away from median plane. Proximal means करीब से, नज़दीक से, and superior or cranial, it is close to the head or end of the trunk. For example, your humerus is proximal to your head. However, your phalanges, they are distal to your trunk, because distal means दूर, क्योंकि it is close to the lower end of the trunk. अब यहाँ पे superficial means close to skin or towards the surface of the body. Deep means away from skin or away from the surface of the body. Ipsilateral, it means on the same side. Ipsilateral means on the same side. However, इसका जो opposite है, that is contralateral, which means opposite side of the body from another structure. Now, the word invagination and evagination, जहाँ पे in आएगा, this means inside. So invagination means projection of something inside your body, while evagination means projection of something outside of your body, because word e जहाँ पे भी आएगा, that means outside, यानी बाहर की तरफ. Now we will look the figures at different terms in relation to the body of your trunk. अच्छा, so इस figure से I will try my best कि मैं different terms used in relation to your trunk, neck and face of the body. Now this one is your superior plane, ये आपका posterior है, ये आपका ventral और anterior one है. This is your mid sagittal line, और इसके जो पास में होगा that will be your medial one, while इससे जो दूर होगा that will be your lateral one. अब look at this image. Distal will be far from the trunk. However, proximal will be near to trunk, like this. Humerus is proximal to your trunk. However, phalanges are distal to your trunk. Now, यहाँ पे this look here. This right hand and right leg, they are ipsilateral to each other, but the right hand and left leg they are contralateral to each other. Now again, this is your inferior aspect, this is your superior aspect of the body. Now we will continue towards the यहाँ पे भी वही है. अच्छा, इसको भी अगर मैं बता दूँ, सो दिस इज योर लेटरल बॉर्डर, ये आपका ये मीडियल बॉर्डर है, ये लेटरल बॉर्डर है, दिस इज योर एंटीरियर सरफेस, दिस इज योर फ्लेक्सर एस्पेक्ट, और दिस इज योर proximal or superior end. This is your upper end of the lower limb, and this is your distal or inferior end of the lower limb. This is the anterior surface. This is dorsum of foot, or this is the inferior of your upper limb, and this is the superior of your upper limb. Now continuing, this image tells us about the superficial and deep. If you guys remember, superficial means, if you guys remember, superficial means close to the skin, बिल्कुल आपके स्किन के करीब, and deep means it is far from the skin, it is deep inside your body. अब यहाँ पे जो figure 1.16, it tells us about the invagination, means something coming inside. Evagination means something going outside. Evagination means something going outside. Now again, terms used in relation to upper limb. Ventral or anterior is the front aspect. Dorsal, posterior or back aspect. Medial border lies along the little finger, medial border of forearm and arm. Medial border जो है, that lies along your little finger, medial border of your forearm and arm. Now the lateral border, it follows the thumb. Lateral border of forearm and arm. We will see these in the figure 1.14. Where is figure 1.14? Let me check that one. Figure 1.14, it is here right now. Figure 1.14. Okay, so as you check कि जो mid finger है और बिल्कुल middle है of the arm and forearm, this is your medial aspect, और बिल्कुल thumb के इस साइड पे और बिल्कुल lateral aspect ये होगा. It is your lateral aspect of upper limb, and it is your medial aspect of the upper limb. Proximal means close to the root of limb. Like I said, humerus is proximal. This distal means away from the root, like phalanges are away. Palmar means the aspect in front of palm. When we pray, we use palmar aspect. इसको इसी तरह आप आसानी से याद रख सकते हैं. Dorsal means as it is the back of palm. When we do sajda, तो उस वक्त हम अपने हाथ को डॉर्सल एस्पेक्ट पे रखते हैं, बट जब हम लोग दुआ करते हैं उस वक्त हम हाथों को पाल्मर एस्पेक्ट में रखते हैं. फ्लेक्सर is the front of upper limb. However, extensor is the back of upper limb. Flexor means front, extensor means back. Yani flexor will be your anterior aspect, extensor will be your posterior aspect. Flexor will be your ventral aspect, extensor will be your dorsal aspect. Now terms used in relation to lower limb. Posterior means the back of lower limb. Anterior means the front of lower limb. Medial border lies along the big toe or hallux, and medial border of leg and thigh. In figure 1.13 it is shown. Let me show it to you again. अच्छा, जो यहाँ पे है, let me just erase this one. Let me erase this one. और अभी आपको बताता हूँ कि जो big toe है इसके और इस तरह, this is the medial aspect. अब इसके बिल्कुल यहाँ पे this is the lateral aspect of lower limb. This is your lateral aspect. Lateral aspect, it lies along your little toe, lateral border of leg and thigh. Flexor is the back of lower limb. यहाँ पे एक exception है और इसकी भी basic use आ सकती है. However, extensor is the front of lower limb. Proximal is close to the root of limb, while distal is away from limb. Flexor is the back of lower limb. अगर आपको याद हो यहाँ पे upper limb में flexor is your front of upper limb. However, in lower limb, flexor is the back of your lower limb. Or extensor जो है, it is the front of lower limb, while extensor is the back of your upper limb. ये exception है and it may come in your exams. Now, terms of relation commonly used in embryology and comparative anatomy, but sometimes in gross anatomy too. Now, ventral means towards the belly, like anterior; dorsal towards the back, like posterior; cranial or rostral. This is a new term for you, rostral or cranial. It means towards the head, like superior. Caudal means towards the tail, like inferior one. Now, terms related to body movements. This is also important. Movements in general, its synovial joints are divided into four categories. इसकी four categories है. One is your gliding movement. It is relatively flat surfaces. It is relatively flat surfaces move back and forth from one side from side to side with respect to one another. The angle between articulating bones does not change significantly. Now, if I say back and forth movement, this is your gliding moment, और यहाँ पे angle between the articulating bones does not change significantly. This is the important point. ये back and forth moment है of flat surfaces and यहाँ पे articulating bones का जो angle है that does not change. Second one is your angular moment. It is defined as the angle between articulating bone decreases or increases. It is important one. यहाँ पे flexion. In flexion there is decrease in angle between articulating bones. In flexion, remember flexion means decrease. However, remember in flexion there is always decrease in angle between the articulating bones, like however, in extension there is increase. In extension there is increase in angle between the articulating bones. Flexion or extension एक दूसरे के opposite है. Now, coming towards lateral flexion, it is the movement of trunk sideways to right or left at the waist. Lateral flexion is the movement of body parts away from the midline. Lateral flexion is the movement of trunk sideways to the right and or left at the waist. Now, adduction is the movement of bone towards the midline. However, abduction is the movement of the bone away from the midline. Adduction means करीब आना. Abduction means दूर जाना. Yani adduction is the movement of bone or body parts towards the midline. However, abduction is the movement of bone away from the midline. Now, third one is your rotation. In rotation, a bone, नाम से जाहिर है, a bone revolves around its own longitudinal axis. In medial rotation, the anterior surface of a bone of limb is turned towards the midline. Medial है, this means it will come towards the midline. However, in lateral rotation, the anterior surface of a bone will go away from the midline. Now, fourth is special movements. These occur only at certain joints. For example, pronation, supination at radio-ulnar joint. Protraction means आपके दांतों का बाहर जाना, and retraction is opposite of protraction at temporomandibular joint. Now, in upper limb, flexion, when two flexor surfaces are brought close to each other. For example, when two flexor surfaces are brought close to each other in upper limb, it is an elbow joint. When front of arm and forearm are opposed to each other, it is known as flexion. Now, coming towards extension, what is extension? In extension, when an extensor or dorsal surfaces, remember फ्लेक्शन में अपर लिम्ब में हमेशा एंटीरियर सर्फेसेस इन्वॉल्व होगी. However, in extension, the dorsal or posterior surfaces will be involved. When extensor or dorsal surfaces are brought in as much approximation as possible, that is, straighten the arm and forearm at elbow joint. Remember one thing regarding the upper limb कि जो इसका anterior aspect है, ventral aspect है या जो frontal aspect है, that will also that will always cause flexion. और यहाँ पे जितनी भी muscles हैं, they will be responsible for flexion apart from their other movements. However, जो back पे बाकी, however जो dorsal और posterior aspect of upper limb है, that is responsible for extension. तो यहाँ पे जितने भी muscles हैं या bones हैं, तो यहाँ पे जितनी भी muscles हैं, they are involved in the extension of your upper limb, and it means that straightening of the arm and forearms at elbow joints is extension. However, bringing arm and forearm close together, it means it is flexion. Now coming towards the abduction, it is when the limb is taken away from the body. Abduction, when the limb is taken away from the midline. Adduction, when the limb is brought closely to the midline. This is your midline. अगर इसके close आएगा, this will be adduction. अगर इससे दूर जाएगा, this will be your abduction. Now circumduction, it comes in your BCQs. Circumduction is a movement of distal end of a part of the body in a circle. क्योंकि circum means in a circular action or move. क्योंकि अच्छा, it is a combination of extension, abduction, flexion and adduction in a sequence. So circumduction is a combination of circumduction is a movement of distal end of a part of the body in a circle. Basically, it is a combination of, first of all, extension, then abduction, then flexion and adduction in a sequence. और ये repeated movement होगा. और इसका example है as in throwing a ball while bowling. Medial rotation, when the arm rotates medially, bringing the flexed forearm across the chest. Lateral rotation, when the arm rotates laterally, taking the flexed forearm away from the body. Supination, it is when the palm is facing forward, as in putting food in mouth. जब हम लोग कोई चीज़ खा रहे होते हैं, so we use our palm in the supination. However, pronation, when the palms faces backward or downwards, as in picking the food with fingers. अच्छा, जब हम कोई खुराक ले रहे होते हैं उस वक्त हमारा palm जो है that is in pronation. However, जब हम उसको खा रहे होते हैं, at that time our palm is at supination. Now abduction of digits or fingers, when all the fingers get together. जब आप तमाम fingers को touch करते एक साथ, that is your adduction. Abduction, when all the fingers are separated. The axis of movement of fingers is the line passing through the the axis of movement of fingers is the line passing through the center of middle finger or position of thumb. It is when the tip of your thumb touches the tip of any of the fingers. अब आपका thumb है, उसका tip ने आपका thumb है, उसके tip ने किसी और finger के tip को touch किया. This is your opposition of thumb. Now circumduction of thumb, it is movement of extension हो गया, abduction हो गया, then flexion and adduction in sequence. We will continue with anatomical terms used in relation to the lower limb. First is your flexion of thigh. It is when the front of thigh comes in contact with the front of your abdomen. It is when the front of thigh comes in contact with your abdomen. Like जब आप किसी फुटबॉल को शूट कर रहे होंगे, आप अपने thigh और पूरे leg को आगे करते हैं. That is your flexion of your thigh. Extension of thigh, when the person stands still or erect. Abduction is the thigh taken away from the medial plane. Adduction is the thigh brought close to median plane. Medial rotation, when the thigh is turned medially. Lateral rotation, when the thigh is turned laterally. Flexion of knee, it is when the back of thigh and back of leg come in opposition to each other. This is your circumduction. अच्छा, ये जो figures है इसको आप लोग खुद देख लेना, because I have discussed these things already in your theory. इसके बाद है extension of knee. It is when the thigh and leg are in straight line as in standing. Dorsiflexion of foot, हमारे लोग अक्सर dorsiflexion और plantar flexion को mix up कर लेते हैं. Now it is when the dorsum of foot is brought close to front of the leg and sole faces forward. जब आपका sole forward axis पे, like in figure 1.18, in figure 1.18 आपका sole फ्रंट फेस कर रहा है, आपका dorsum is close to your leg. This is dorsiflexion. Now plantar flexion, it is when your sole is facing in the back direction, और जो आपका dorsum of foot है that is away from your leg. This is known as plantar flexion. इसके बाद है inversion of foot. The word inversion of foot means the turning of your foot inward, while eversion means turning of foot outward. जब आपको outward and inward, out means whenever e comes, this means outward. Whenever I and in comes, this means inward in most of the terms of anatomy. अच्छा, इसके बाद है anatomical terms in relation to neck. Flexion is when face comes closer to the chest. अच्छा, जब हम किसी चीज़ को देख रहे होते हैं ऑन और टेबल या हम बुक रीडिंग कर रहे होते हैं, so then our neck is flexed. Extension, when the face is brought away from the neck. जब हम आसमान को देख रहे होते हैं then our neck is in extended position. और इसी तरह के BCQs भी आपके पास आ सकते हैं in JSM, UDA और आप जहाँ से भी पढ़ रहे हैं. Lateral flexion of the neck, it is when the air is brought close to the shoulder. Rotation of the neck, when the neck rotates so that the chin goes to the opposite side. Opening of the mouth, it is when the lower jaw is lowered to open the mouth. Closure of the mouth, when the lower jaw is opposed to the upper jaw, closing the mouth. Protraction एंड रिट्रैक्शन, इसमें भी हमारे लोग बहुत ज़्यादा कंफ्यूज हो जाते हैं. मैं फिगर से आपको समझा देता हूँ. इन फिगर 1.19, इन फिगर 1.9 बहुत यहाँ पे बताया भी है. इन फिगर 1.9 it is told that when the lower jaw is comes forward, this is known as protraction. जब lower jaw backward movement करता है, this is known as retraction of your lower jaw. Now, anatomical terms in relation to trunk. Backward bending is called extension. Is like in this figure, ये बंदा backward bending कर रहा है, so this is his extension of the trunk. ये बंदा forward bend कर रहा है, this is the flexion. ये बंदा sideward movement कर रहा है, this is his lateral flexion. और sideward rotation को बोलते हैं lateral rotation. Now terms used for describing muscles, ये बहुत important है, इसको अभी से सीख लें क्योंकि locomotor mood में आप क्योंकि locomotor module में आपको यही काम आना है. Now, what is origin? Origin is the end of a muscle which is relatively fixed during its contraction. Muscle का वो end जो कि contraction के वक्त fixed होगा. Like this one is the origin of long head of supraglenoid tubercle. This is the origin of short head from the coracoid process. And this is your muscle belly. यहाँ पे है इंसर्शन. इट इज़ द एंड ऑफ अ मसल विच मूव्स ड्यूरिंग कंट्रैक्शन. आपके पास BCQs में आ सकता है कि व्हाट इज इंसर्शन. इट इज़ द एंड ऑफ अ मसल विच मूव्स ड्यूरिंग इट्स कंट्रैक्शन. ओरिजिन इज द एंड ऑफ अ मसल विच इज रिलेटिवली फिक्स्ड टू अ बोन ड्यूरिंग इट्स कंट्रैक्शन. अच्छा, वो बोन के साथ भी हो सकता है, लिगामेंट के साथ भी हो सकता है. यहाँ पे है द टू टर्म्स ओरिजिन एंड इंसर्शन आर समटाइम्स इंटरचेंजेबल. व्हेन ओरिजिन मूव्स, the insertion is fixed. Now, what is belly? It is the fleshy part or contractile part of a muscle. What is tendon? It is the fibrous, non-contractile and cord-like part of a muscle. Tendon is the fibrous and non-contractile, and it is a cord-like part of the muscle. What is aponeurosis? It is the flattened tendon. It is the flattened sheath of the tendon. ये भी बहुत से लोगों को कंफ्यूज करता है कि what is aponeurosis. Aponeurosis is the flattened sheet of a tendon. What is raphe? It is a fibrous band made up of interdigitating fibers of tendons. Or aponeurosis, unlike a ligament, it is stretchable. Raphe और ligament में ये फर्क है कि ligament cannot be stretched. However, raphe can be stretched, and it is a fibrous band made up of interdigitating fibers of tendons. Or aponeurosis, ligaments fibrous inelastic bands है जो कि connect करते हैं two segments of a joint को. Ligaments are the fibrous inelastic bands which connect the two segments of a joint. Now, terms used for describing vessels. What are arteries? Basically, arteries are those blood vessels which carry oxygenated blood away from the heart with exception of pulmonary and umbilical arteries. ये BCQs में आ सकता है in your foundation module कि which arteries do not carry oxygenated blood away from the heart. So these are your pulmonary and umbilical arteries क्योंकि वो carry करते हैं. Pulmonary artery carries the deoxygenated blood from your heart to your lungs. However, umbilical arteries, they carry the deoxygenated blood from the embryo, I mean the fetus, to the mother via umbilicus. Arteries resemble trees because they have branches which are known as arterioles. ये है artery, this is artery, and these are arterioles. यहाँ पे है capillary network है. These are known as venules. फिर this one is your vein. अच्छा, now coming towards the vein. Veins, they carry deoxygenated blood towards the heart with exception of pulmonary and umbilical veins. They carry oxygenated blood in place of deoxygenated blood. क्योंकि यहाँ भी ये BCQs में आ सकता है कि which veins do not carry deoxygenated blood towards the heart. Remember, pulmonary and umbilical veins, they carry oxygenated blood. They never carry deoxygenated blood. Veins resemble rivers because they have tributaries, venues. अब यहाँ पे आप आसानी से देख सकते हैं. अच्छा, इसकी एक और important point है. Veins have valves to allow unidirectional flow of blood. However, arteries do not have any valve. Arteries में कोई भी valve नहीं है because vein carries blood from different parts of the body to the heart. तो इसको valves की ज़रूरत होती है. However, arteries do not need any valves. Now, the third one is your capillaries. They are network of microscopic vessels connecting arterioles to venules. They are माइक्रोस्कोपिक वेसल्स है जो कि आर्टेरियोल्स को वेन्यूज के साथ कनेक्ट करते हैं. डी इज एनास्टोमोसिस. इट इज अ प्री कैपिलरी और पोस्ट कैपिलरी कम्युनिकेशन बिटवीन नेबरिंग वेसल्स. नाउ हियर दिस वन इज योर एनास्टोमोसिस. This one is your anastomosis, which connects the capillaries to other blood vessels. This one is your anastomosis. This is pre-capillary. So sorry, this one is your pre-capillary anastomosis. This one is your post-capillary anastomosis. Now, terms used for describing bone features. Elevations mean linear elevation may be line, lip, ridge, or crest. Sharp elevation may be spine or styloid process. Rounded or irregular elevation, yani ubhar. Elevation means ubhar, something elevated. It may be a tubercle, tuberosity, epicondyle, malleolus, trochanter. A ramus is a bowed arm or processing projecting from the main body part. Ramus is a broad arm or process which projects from the main part of the body. Well, depressions, something inside, like a pit. It may be a pit, impression, or fovea or fossa or groove or notch. Openings may be foramen, canal, hiatus or aqueduct. इसके बाद है, now this is like just, this is anastomosis around your elbow joint. Okay, so here it comes, fourth is cavities. It's a large cavity within a bone is called sinus, cell or antrum. A large cavity inside a bone is called sinus, cell or antrum. Smooth articular areas may be a facet, condyle, head or capitulum or trochlea. In next video, I will be discussing about the terms used in clinical anatomy, or if you remember those terms now, they will form the foundation of your whole anatomical